Imagine waking up in the middle of the night feeling like your mouth has been stuffed with cotton balls. You reach for a glass of water, but even after a few gulps, that parched sandpaper feeling just won't go away. Then you look in the mirror and notice your eyes are bloodshot, stinging as if someone tossed a handful of fine grit directly into them. You might dismiss it as a bad night's sleep. Maybe the air conditioning was too high. Or perhaps you're just getting older. But what if your body is actually trying to send you an urgent flare? What if these annoying daily hiccups are actually the early warning signs of an invisible predator called Sjögren syndrome? This is one of the most underdiagnosed autoimmune conditions in the world, often hiding in plain sight for years while it quietly wreaks havoc on your system. Today we are breaking down the 8 critical symptoms that mean your body is screaming for help. We aren't just talking about a little dry mouth here. We are diving into the systemic signals that millions of people ignore until it's almost too late. If you've been feeling off lately and can't put your finger on why, you need to listen very closely to every single word of this, because the last 2 symptoms on our list are often mistaken for completely different diseases. Let's jump straight into the first and most iconic red flag, the chronic dry mouth, or what medical professionals call xerostomia. Now, we've all had a dry mouth before, maybe after a long run or a nervous public speaking gig. But Sjögren's dry mouth is on a completely different level. It's not just about feeling thirsty. Imagine trying to eat a dry cracker or a piece of bread and finding it physically impossible to swallow because your mouth simply isn't producing saliva. Saliva isn't just spit. It's a complex fluid packed with enzymes that kickstart digestion and antibodies that protect your teeth. When Sjögren's attacks the moisture-producing glands, that protective barrier vanishes. You might notice a burning sensation when you eat spicy or acidic foods. Your tongue might start to look ribbed or cracked, almost like a piece of dry leather. Some people even find that their voice changes, becoming hoarse or raspy because the vocal cords aren't being lubricated. This is your body's way of saying that the moisture-making factories are under siege. Moving on to the second major scream from your body, the gritty eyes. This goes far beyond the occasional itch. People with Sjögren's often describe the sensation as having sand, gravel, or even shards of glass constantly rubbing against their eyeballs. This happens because the lacrimal glands, the ones responsible for your tears, are being targeted by your own immune system. You might find yourself blinking constantly, or feeling an overwhelming urge to keep your eyes closed just to get a moment of relief. Paradoxically, some people actually experience watery eyes initially. This is because the eye, sensing it is too dry, sends a panic signal to produce emergency tears. However, these tears are mostly water and lack the essential oils and mucin needed to actually lubricate the eye. If you find yourself reaching for eye drops every 30 minutes, or if your vision feels blurry and clears up only after a heavy blink, your body isn't just tired. It's struggling to maintain the most basic biological film necessary for sight. Now let's talk about something that many people write off as just being busy, and that is profound. This isn't the kind of tired you feel after a long day at work. This is a bone-crushing, soul-sapping exhaustion that doesn't go away with a weekend of sleep. Imagine waking up after 10 hours of rest and feeling like you've just run a marathon while fighting the flu. Many patients describe it as brain fog, where trying to focus on a simple task feels like trying to run through waist-deep mud. Your immune system is effectively stuck in the on position, constantly fighting a war against your own healthy tissues. This consumes an incredible amount of metabolic energy. If you find that you're suddenly needing naps every afternoon just to function, or if your limbs feel like they're made of lead, symptom number 4 is something that often sends people to the dentist before they realize it's a systemic issue: rapid dental decay and mouth sores. We mentioned how saliva protects your teeth, but the consequences of losing it are devastating. You might be someone who has practiced perfect oral hygiene your whole life, yet suddenly you're showing up to your checkup with 5 new cavities. Without saliva to neutralize the acids produced by bacteria and to wash away food particles, your teeth are sitting in a highly corrosive environment, 24 hours a day. Furthermore, you might notice frequent thrush or yeast infections in the mouth, appearing as white patches or painful red areas. If your dental health is cratering despite your best efforts, or if you're developing ulcers on your gums and cheeks that won't heal, your body is telling you that the primary defense line of your digestive tract has been breached. The 5th sign is one that is frequently ignored because it's so easy to blame on the weather, and that is persistent dry skin and mysterious rashes. Sjögren's doesn't just stop at the eyes and mouth. It can affect all the exocrine glands, including the ones that keep your skin supple and hydrated. You might notice that your skin feels tight, itchy, or even flaky, no matter how much lotion you apply. Some people develop a specific type of skin sensitivity known as purpura. This happens when small blood vessels become inflamed. This is a sign that the autoimmune process is moving beyond moisture glands and into the vascular system. If your skin has lost its glow and feels like it belongs to someone 20 years older, or if you're seeing strange spots that don't itch or hurt but won't go away, your body is signaling a deeper inflammatory issue. Now we move into the sixth symptom, which is joint pain and stiffness. This is where Sjögren's can be very tricky because it often mimics rheumatoid arthritis. You might wake up in the morning and find that your fingers are swollen and hard to move. Your knees, wrists, or ankles might feel hot and achy. Unlike the wear and tear of osteoarthritis, this pain is usually symmetrical, affecting both sides of the body at once. It's caused by the same inflammatory cytokines that are attacking your moisture glands. Many people think they're just getting creaky with age, but if this stiffness lasts for more than 30 minutes every morning, or if your joints are visibly swollen without a specific injury, your body is sounding a loud alarm about systemic inflammation that needs professional attention. Symptom number 7 is one that can be quite frightening if you don't know what's happening. Swollen salivary glands. Have you ever looked in the mirror and noticed your face looks wider, or like you have the mumps? Specifically, the glands right in front of your ears and under your jaw can become firm, tender, and enlarged. This is known as parotid gland swelling. It happens when the white blood cells, the very cells meant to protect you, swarm into these glands in such high numbers that they cause a physical blockage and massive inflammation. Sometimes this swelling comes and goes, but other times it becomes a permanent change in your facial structure. If you feel lumps or a sense of fullness along your jawline that wasn't there before, your body is showing you exactly where the battleground is located. Finally, we reach symptom number 8, and this is the one that often goes undiagnosed for the longest time: chronic dry cough and respiratory issues. Your lungs and airways are lined with mucous membranes that require moisture to trap dust, allergens, and pathogens. When Sjögren's dries out these passages, you might develop a dry, hacking cough that feels like it's coming from deep within your chest. You might feel short of breath, or like there's a constant tickle in your throat that no lozenge can soothe. In some cases, this can lead to recurrent bronchitis or even more serious lung involvement. This is the body screaming that its internal filtration system is failing. This symptom is often mistaken for asthma or allergies, but if it doesn't respond to traditional inhalers or antihistamines, it's time to look at the bigger picture of Sjögren's. Now that we've covered these 8 screams from your body, it is vital to understand why this matters right now. Sjögren's syndrome isn't just about dryness, it is a systemic disease. It can affect the kidneys, the liver, and even the nervous system. When the body is in this state of constant high alert, it changes the way you process nutrition, the way you handle stress, and your overall risk for other health complications. The tragedy is that the average person waits nearly 7 years from the onset of symptoms to get a formal diagnosis. 7 years of managing dry eyes, 7 years of dealing with fatigue, and 7 years of the disease potentially progressing. Why is it so hard to catch? Because we've been conditioned to look at symptoms in isolation. We go to the dentist for the teeth, the eye doctor for the eyes, and a general practitioner for the fatigue. We rarely connect the dots. But your body is a single unified system. Those dry eyes and that joint pain are part of the same story. If you're experiencing 3 or more of the things we just discussed, you need to advocate for yourself. Ask for specific blood tests, like the anti-SSA and anti-SSB antibodies, which are common markers for Sjögren's. The good news is that while Sjögren's is a lifelong condition, it is manageable. There are ways to stimulate moisture, ways to dampen the overactive immune response, and lifestyle changes that can help you reclaim your energy. It starts with listening. Your body is not trying to annoy you with these symptoms. It's trying to protect you. It's letting you know that the self versus non-self recognition system is a bit confused. Think about the impact on your daily life. Sjögren's can make it hard to enjoy a meal with friends because you're constantly worried about having enough water to swallow. It can make driving at night difficult because your eyes are too dry to handle the glare. It can steal your productivity. But once you have a name for the enemy, you can start fighting back. You can look at anti-inflammatory diets, specialized hydration strategies, and medical interventions that stop the progression. It's also important to talk about the emotional side. Living with a hidden disease is exhausting. People see you looking fine on the outside, but they don't see the internal fire your immune system is stoking. This leads to a different kind of fatigue, a mental weariness from trying to explain why you can't make it to an event or why you're always carrying 3 tubes of eye lubricant and a water bottle. If you feel like your battery is always at 5%, despite doing all the right things, please don't let anyone tell you it's all in your head. As we look at these 8 symptoms, notice the pattern. It is the loss of the liquid of life in various forms. Tears, saliva, sweat, and mucus. These fluids are the buffers between us and the harsh world outside. Without them, we are exposed, literal and metaphorical sandpaper against the world. Sjögren's is more common in women, especially those over 40, but it can hit anyone at any time. Many people find that their symptoms flare up during times of high stress. This makes sense, as stress hormones can further trigger inflammatory responses. If you notice that your dry mouth gets 10 times worse during a difficult week at work, that is a massive clue. Your nervous system and your immune system are talking to each other. And right now they're shouting. If you are listening to this and realizing that this sounds exactly like your life, please take a deep breath. Knowledge is the first step toward relief. You are not alone in this. There are massive communities of people who are navigating the same desert and have found ways to thrive. By recognizing these signs early, you can prevent the more serious complications that come from chronic, untreated inflammation. We often think of health as the absence of pain, but true health is about balance. Sjögren's is a loss of balance. It's the immune system being too vigilant, too aggressive. The goal of management is to bring that balance back. We have to look at the gut health, as that is where a majority of the immune system resides. We have to look at environmental triggers, like dry air, or certain chemicals that might be making the dryness worse. If you have a dry cough that won't go away, or if you feel like you're constantly swallowing around a lump, don't wait. If you're waking up with eyes that feel glued shut, don't wait. If your dentist is shocked by your sudden cavities, don't wait. These aren't just quirks of your biology. They are evidence. They are your body's way of screaming for a ceasefire. The most important thing to remember is that you are the expert on your own body. If a doctor tells you you're just stressed, but you know that your mouth shouldn't feel this dry, push for more answers. Seek out a rheumatologist, as they are the specialists who handle autoimmune conditions like Sjögren's. They can do the lip biopsies or the specialized blood work that can confirm what your body has been trying to tell you all along. Living with Sjögren's means becoming a bit of a detective. You start to notice which foods make your mouth feel worse, like crackers or salty chips, and which ones help, like cucumbers or melons. You learn that small, frequent sips of water are better than big gulps. You discover the wonders of humidifiers and preservative-free eye drops. It's a transition from a passive participant in your health to an active advocate. The ripple effect of identifying this condition is huge. Once you treat the underlying inflammation, you might find that your unrelated joint pain starts to fade. You might find that your unrelated brain fog starts to lift. It's all connected. The dry eyes aren't just an eye problem. They're a Sjögren's problem. The fatigue isn't just a sleep problem. It's a Sjögren's problem. Imagine a life where you aren't constantly distracted by stings and parched feelings. Imagine having the energy to get through your day without that heavy, foggy feeling, clouding your every thought. That life is possible, even with a diagnosis. But it all starts with recognizing these 8 screams. Your body is incredibly intelligent. It doesn't create symptoms for no reason. It uses these signals to communicate when things are out of alignment. Don't let these signals become the background noise of your life. Don't let yourself get used to the discomfort. You deserve to feel hydrated, energetic, and comfortable in your own skin. The Sjögren's scream is a call to action. It's an invitation to look deeper, to care for yourself more intentionally, and to seek the help that can stop the silent progression of this disease. Whether it's the gritty eyes, the swollen glands, or the mysterious dental issues, take these signs seriously. Your health journey is a marathon, not a sprint, and you need to have your supplies ready. Hydration, nutrition, and medical support are your best friends. Listen to your body, respond with kindness and professional care, and you can turn those screams back into whispers. You have the power to change your health trajectory today. Listen to the signs, take the steps, and reclaim the comfort that is your birthright. Stay vigilant, stay curious about your health, and always remember that you know your body better than anyone else. It's time to listen to what it's saying.